Tonight on World Report, Americans headed to the border, not for Mexican food, not for vacation, but for root canals. The new phenomenon of dentistas. They're cheap, sure, but is it safe? This is World Report. Now, correspondent Pat Woodard on the U.S.-Mexico border.
In dusty desert towns along a 1,400-mile border, the promise of what waits on the other side fuels a desperate migration from one nation to another. An escape into Mexico.
I understand the town is clean.
Tony McKernan, Gene Dowdy, and Lou Edmonds left Phoenix at 6:30 this morning.
I put it off a long time.
Feeling a little dangerous.
I was a little leery at first.
Gene, Tony, and Lou are not kids. The politically correct term is active seniors. Today's activity? A date with a dentista.
Oh, I'm coming down to have a crown put on my tooth.
I'm having a new plate made on the top.
I'm having a bridge built on that tooth right there.
Welcome to Los Algodones, Baja California, Mexico. 4 square blocks, said to be occupied by more dentists per capita than anywhere else in the world. $15 for a cleaning, $250 for a root canal, and everywhere you look, dentistas inviting you to put your teeth in their hands.
95% of their patients are American dental patients. The facilities in Mexico have lower real estate costs. They have lower payroll costs to their staff.
Ron Vinlawan owns Dayo Dental, and once every 2 weeks he runs a shuttle to Los Algodones.
The most people we've taken down is 7 people.
People like Gene, Tony, and Lou, who are chomping at the bit to get there after visiting their dentists back home.
The implant in the U.S. would have cost me over $4,000. I had the implant price down here, and they do implants for $1,600.
But that's $1,600 in Mexico. Mexico, where you're not even supposed to drink the water.
The first time I was going to have a medical procedure in Mexico, my family thought I'd gone over the edge.
Jean Dowdy says her family's image of a Mexican clinic had chickens running loose on a dirt floor and a guy in a sombrero carrying a rusty machete.
I think the medical and dental profession in the United States throws out a lot of that because they don't want you taking your business out of the country.
This is my 3rd time down here. And to be honest with you, I was super impressed with the facility, the cleanliness, the staff, the procedures. In all honesty, I would say that they were better than the dentist that I went to in the U.S.
In dental clinics across America, the response is, ouch.
The standard of care simply is not the same.
Dr. Richard Black is a former president of the Texas Dental Association. He says, sure, it's possible to find a good dentist in Mexico.
But we also know that there's a population of people purporting to be healthcare professionals that maybe their training is somewhat suspect.
Just to be safe, you could walk in and check out every clinic in Los Algodones, but you better have some time to kill. So here on Alamo Street, I've counted 17 dental clinics, 18, 19, 20, 21, and we've barely scratched the surface. If a guy wanted to keep counting, he wouldn't run out of clinics until he hit 300. So how do you know what you're getting into when you walk across the border into a town with 300 dentistas?
Clients are connected to pre-screened dental facilities. We spend a lot of time and resources screening these dental facilities based on their safety practices, their facilities, their combined years of experience, all the way down to their ethics.
Dayo Dental says it even sends undercover operatives to Mexican clinics to see if they recommend more work than a patient needs. This is it, huh? This is the clinic in Los Algodones where Dayo Dental refers its clients.
Looks nice.
It's clear to me the patient they came from because we are cheaper, but they never expect fine facilities like you guys find today.
Polished wood floors and high-def TV in the waiting room, granite countertops at the reception desk. Not a chicken in sight.
Close your eyes and don't move, please.
Gene Dowdy has never had an x-ray taken using a panoramic digital x-ray machine.
I'm impressed.
It's most important to me have a nice clinic instead of to have a nice house. Some other colleagues, they have nice houses and fancy cars, but they don't have a nice clinic.
Meet Dr. Carlos Rubio. No sombrero, no rusty machete, just a wall covered with advanced certificates in bone grafting and implants from U.S. universities. If Dr. Rubio is unqualified, he's pretty good at hiding it. Upstairs from the room where he's performing an implant procedure, other dental professionals watch and learn.
My colleagues in Mexico, they don't have the access to cross the border or the money, so we're working with the universities or the prime institute to bring this technology.
And here's the latest addition to the Los Algodones dental empire.
We are the first one, I guess, in the country.
It's a 3D dental scanner boasting the most advanced imaging technology on the market.
So with this kind of technology, patients, they are more safe, and we take off possible mistakes we can do it because we know where we are before going in with this kind of technology.
Lou Edmonds is having his bridge installed by one of Dr. Rubio's associate dentistas. Dr. Rubio says Lou is getting the same quality of care he'd get in the States.
And we follow the rules. The rules in dentistry, they should be universal.
Are they?
Should be. I don't know, but they are here in the office.
Across the border, back in the USA, American dentists like Dr. Stephen Caldwell say the rules are not the same because when something goes wrong, there's no place like home.
If I treat a patient and there's a problem, then the patient will receive a refund. I will be sanctioned by my state board of dental examiners, and in the worst case, there will be a malpractice suit. And in Mexico, in treatment where complications arise, there's no recourse for those patients.
Just ask Beatrice Marshall. She went to a clinic in Juarez a year ago and came back with 26 crowns and a mouthful of hurt.
I couldn't eat.
The bleeding?
I was bleeding.
And the dental work that was placed there is a problem because it looks like they just took a piece of wax and cut this with a knife between these teeth. This leaves massive discrepancies between the spot where the crown should meet the tooth and where it does. So this is built to fail, built to decay, and built to ruin the gums.
Beatrice says her Mexican dentist told her she'd be eating steak with her mashed potatoes the night of her procedure. He was right about the mashed potatoes. That's about all she's been able to chew for a year.
They gave us a little 2-year certificate that they would be more than happy to help her. Well, after the butch job they did on her, I would not trust them to an animal.
I am angry and disappointment, very disappointed that they did this to me.
Beatrice says she's afraid to go back to the Mexican clinic where she had her work done. This was a patient by the name of Beatrice Marshall. Are you familiar with that?
No, not at all.
It was so we did.
That's a shame because did she talk to our manager?
I talked to her daughter yesterday and she said she's been calling, has not been able to get a response.
Really? Let me take that name.
Is there a chance for Mrs. Marshall to maybe get a refund?
Sure. She would have to discuss it with the manager, but yes.
It's possible.
Yes. Mm-hmm. We have done it before.
The clinic did offer to redo Mrs. Marshall's crowns. She said no way. Her request for a refund was denied. She could sue, but Mexican law makes it almost impossible to sue for malpractice.
Welcome to Mexico.
That's another reason dental care prices are so low in Mexico. But there's a bigger one.
Typical take-home pay for a dentist in Mexico is about $25,000 to $30,000 per year. And a dentist in the U.S., the last time I checked, the average profit take-home pay for a dentist was about $150,000 a year.
Dentists in the U.S. say there are good reasons their colleagues in Mexico make so much less money, starting with their training. The Autonomous University of Ciudad Juarez is home to one of Mexico's major dental schools.
The student is in the last semester in the school.
Students at this university clinic were in dental school the day they started college.
Well, we have the program in semesters. They can be a dentist with 10 semesters.
That's 5 years total, compared to the U.S. requirement of 4 years as an undergraduate and another 4 years in dental school. American dentists say that's why the U.S. has no dental school accreditation agreement with Mexico, as it does with Canada.
I'm an El Paso native.
So what's an American like Mario Villegas doing studying medicine in Juarez?
It's more focused.
Mario went to an American college for 2 years. He says here he studies medicine, and he isn't forced to take unrelated courses. So he believes he's learning more in less time.
The first 2 years, you focus on pure basic sciences oriented towards medicine. I think education and training are at a magnificent level right now.
Better again? It's better?
Yeah.
Okay.
Rubio Dental in Juarez opened its doors in 2005. Its dentists graduated from university dental schools throughout Mexico. And no matter how much experience they've got, they're still required to take courses to upgrade their skills.
We need to take this 2 times a year.
Really?
But most patients coming to Mexico rely mainly on word of mouth or mouse.
They found us on the internet, and we've had patients visit us from just about every state in the U.S.
The questions that I always have with the patient about the water.
Sometimes patients ask if the clinic uses distilled water or if it has the same kind of sterilization units used in American clinics. But a lot of people are like Bill Spencer,
Right now, I'm gonna take it off.
who drove all the way from Alaska, guided by little more than Rubio Dental's website and a friend's new smile.
The front feels really good. This back one still feels a little high.
I'm always surprised that people are just simply willing to say, well, if someone else had a pretty good experience and the price was right, I'm not really going to question the credentials of the doctor that I'm going to go see.
Bill Spencer has no complaints about his dentista's credentials or his work.
Yeah, it looks good. I had an Novocaine here, so it looks like when I was, younger, and I'm happy.
This is another case where the patient went to Mexico.
At any given time, Dr. Stephen Caldwell says he's got 5 or 6 patients who went to Mexico for a good deal and came back with a great deal of pain and trouble.
I'm sure they're very well-trained doctors. I think they're very experienced people. I just don't know who's who.
Your place warranty 1 year full.
For Jean Dowdy, using a referral company like Dayo Dental answered a lot of questions and saved a lot of time, on top of the $1,800 she's saving on her dental work. Americans coming to Mexico say they respect the skill and dedication of dentists back home, but they don't believe American dentists have a monopoly on quality.
I always say that we have to face the fact that not all the qualified professionals are in this country. There's a whole world out there that have equally qualified dental professionals.
All along the border, a reverse migration of dental refugees is growing.
I don't have my bottom teeth in now, so don't get a close-up, mother.
And a discount dentist in Mexico can even beat one in the family.
My son is a dentist in Houston, and so he wanted me to come to Houston to get this done.
That was before he saw the bill from his dad's dentista and the finished product.
How did your son think your teeth looked?
Great. In fact, he's coming himself.
We all set?
Lou Edmonds, Gene Dowdy, and Tony McKernan load into the Dayo Dental van for the 200-mile ride back to Phoenix.
Very successful day, and everyone's happy, and we had a great time.
In 2 weeks, Dayo will lead another migration of active seniors to Los Algodones, while American dentists look for some way to win the showdown with Mexico's border town dentistas. The way things are going, they'd probably settle for a Mexican standoff.
like this.